Reducing the stigma of substance abuse in the UK. Hi, this is Sanasyal and good morning and thank you for joining today's webinar on reducing the stigma of substance abuse, a critical topic that impacts individuals, families and communities across the UK. I am Sanasyal and I am excited to guide you through this discussion. Despite increased awareness, stigma surrounding substance abuse continues to prevent many people from seeking help. Today, we'll address societal misconception, explore the role of language, and discuss ways to promote empathy and understanding. Together, we can create a more inclusive, supportive environment for those affected by addiction. Addressing societal misconception about substance use and addiction. One of the biggest barriers to recovery is the widespread misconception about substance use and addiction. These misconceptions contribute to stigma, prevent individuals from seeking help, and influence public policy in ways that may not be supportive to those in need. Let's unpack some of these misconceptions and explore how they perpetuate stigma while also discussing ways to reshape public perception. Now, misconceptions about addiction as a choice. A common misconception is that addiction is simply a lack of willpower or a series of bad choices. In reality, addiction is a complex brain disorder influenced by genetics, environment, trauma, and mental health conditions. Viewing addiction through a lens of a personal failure oversimplifies the issues, prevents effective solutions. Now, breaking the myth. The science of addiction, the substance use affects the brain's reward system, altering decision-making abilities and impulse control. The role of genetics. The predisposition studies shows that genetic factors account for up to 50% of person susceptibility to addiction. Impact of childhood trauma, breaking the myth. The science of addiction. Substance use affects the brain's reward system, altering decision-making abilities and impulse control. The role of genetics. Predisposition studies shows that genetic factors account for up to 50% of persons' susceptibility to addiction. Impact of childhood trauma. Individuals with adverse childhood experiences are significantly more likely to struggle with substance dependency. Shifting the narrative. Now, instead of asking why don't they just stop, we should ask what support systems are needed to help them recover. Now, promote education that highlights addiction as a chronic medical condition, much like diabetes or heart disease. Encourage policies that prioritize rehabilitation, mental health support over punitive measures. Impact of misconception. The stigma associated with addiction leads to discrimination in healthcare, employment, and housing. Many individuals avoid seeking treatment due to the fear of being judged or shamed. Societal attitudes shape policy decisions. They make focus on punishment rather than rehabilitation. The influence of British drinking culture. Now, in the UK, alcohol consumption is deeply integrated in social life. Pubs are central to socialization, and drinking is often normalized from a very young age. While moderate alcohol consumption is not necessarily harmful, the way it is socially accepted makes it difficult for individuals to recognize when casual drinking turns into dependency. Explore the impact of drinking culture. Normalization of binge drinking, heavy drinking are often framed and a rite of passage, especially among university students. Many feel compelled to drink to fit in or to avoid being perceived as boring or antisocial. Since alcohol use is widely accepted, people may overlook early warning signs or addiction. And you can address the misconceptions. Schools and universities should implement awareness programs on alcohol dependency and responsible drinking. Workplace policies should encourage responsible drinking, particularly in industry where social drinking is the norm. The media should challenge stereotypes that glamorize excessive alcohol consumption. Now, the impact of these misconceptions, those struggling with alcohol dependency may not realize that they need help until the problem becomes severe. Public health campaigns often focus on illegal substances, overlooking the danger of alcohol misuse. Many people with alcohol dependency are reluctant to seek help due to the stigma of being labeled as an alcoholic. Now, breaking the moral failing stereotype. Still view substance abuse as a moral failing rather than a health issue. The stigma associated with addiction leads to labeling individuals as lazy, responsible, or criminal, which discourages them from seeking help. The perception not only is harmful but is also factually incorrect. How does this stereotype forms? Historical policies have often treated substance use as a legal or moral issue rather than a medical condition. Media portrayals frequently depict individuals with addiction as a reckless or dangerous behavior. Religious and cultural beliefs may enforce that the idea that addiction is a sign of weak character. Reframing addiction as a health issue is important. Public awareness campaigns should focus on addiction as a brain disorder requiring medical intervention. Healthcare providers should be trained to treat substance use disorder with the same compassion as any other chronic illness out there. Society must recognize that recovery is a long time process that requires ongoing support, not just willpower. The impact of these misconceptions, many individuals avoid seeking treatment due to the fear of judgment from family, employees, or society. The criminalization of addiction often leads to incarceration rather than rehabilitation. The lack of funding for addiction treatment program perpetual cycle of substance dependency and poverty. Now, let's take context. Let's take an example. In the UK, efforts are being made to combat stigma and address misconception about substance use. However, challenges remains, particularly regarding alcohol culture and treatment accessibility. Public health initiative, community education, changes in policy can help reshape social attitudes. UK initiative aiming to address these misconceptions now. The National Health Services (NHS) offers addiction treatment program, but access can be limited due to long waiting lists. Organizations such as Alcohol Change UK and Release work to raise awareness and challenge harmful narratives about substance use. Now, harm reduction programs such as needle exchanges and supervised drug consumption facilities are slowly gaining acceptance, which is good. Media campaigns are shifting towards more compassionate portrayals of addiction and recovery stories. The challenges that still remain is that the funding for addiction treatment and mental health services is often inadequate. The cultural normalization of drinking makes alcohol addiction harder to identify and address. The legal system still leans towards punitive measures rather than rehabilitation for substance-related offense. Now, this means that addressing societal misconception about substance use and addiction is essential for reducing stigma and improving access to the treatment. Addiction is not a choice or a moral failing. It is a complex health condition that requires compassion, education, and systematic support. By shifting public perception, we can create a society that fosters recovery rather than judgment. The UK has made progress, though, in addressing these misconceptions, but more work is needed to integrate harm reduction approaches, expand treatment access, and reshape cultural attitudes toward addiction. Through education advocacy, the policy changes, we can build more supportive environment for individuals and families affected by substance use disorder. Now, the role of language in reducing stigma and encouraging treatment. Language has a powerful impact though. on how we perceive and address addiction. The words we use shape public attitudes, influence policies, and directly affect the individual struggling with substance use disorder. Using non stigmatizing, compassionate language can make a significant difference in encouraging individuals to seek treatment, fostering social support, and reducing discrimination. These things do help. Now, avoiding labels. Labels such as addicts, junkies, or substance abuser can be incredibly damaging. These terms define individuals by their condition rather than recognizing their full humanity. Instead, adopting first people language as a person with substance use disorder or a person in recovery emphasizes the person before the condition. Why label matters? Now, research shows that stigmatizing language contributes to negative public attitudes and reduces support for treatment focused policies. Individual labels as addicts are more likely to internalize stigma, leading to shame, isolation, and reluctance to seek help. Healthcare professionals are also influenced by language. Stigmatizing terms can lead to biased treatment and less compassionate care. Shifting to people first language. Instead of drug addict, say a person with a substance use disorder. Instead of clean or dirty, when referring to sobriety, use in recovery or experiencing a recurrence of substance use. Instead of drug abuse, use substance use disorder or substance dependency. Impact of this change. Encouraging dignity and self-worth is individuals seeking recovery. Reduces stigma, making it easier for individuals to reach out for support. Promote a more compassionate and treatment-oriented approach in healthcare settings. The positive framing. Now, language can shape how we perceive addiction, not just as a problem, but as an opportunity for growth and recovery. Instead of using negative or punitive terms, we should reframe discussion in a way that highlights resilience and possibility. Example of positive framing. Instead of substance use problem, say opportunity for recovery. Instead of relapse, say recurrence of use or temporary setback. Instead of failure to stay sober, say working towards substance recovery. Why this matters? Negative framing reinforces hopelessness and discourages individuals from seeking help. Recovery-oriented languages fosters motivation, reinforcing that recovery is possible and ongoing. It creates a supportive culture that recognizes the effort and progress made by the individual in recovery. Real-world application. Community program and healthcare providers should adopt recovery-focused languages in their outreach efforts. Families and support networks should emphasize strength rather than struggle when talking about loved ones. The media should highlight success stories, resilience, rather than focusing solely on the addiction-related crisis. Encouraging open dialogue. The way we ask questions and engage in conversation about substance use can either foster trust or reinforce stigma. People struggling with addiction often avoid seeking help due to the fear of judgment. By adjusting our approach, we can create an environment where the individuals feel safe to share their experiences. Framing conversation to reduce stigma. Instead of why did you start using, ask what challenges you have to face. Now, reducing stigma. Instead of why did you start using, ask what challenges have you faced that led you here. Instead of you need to stop, say how can I support you in your recovery. Instead of what's wrong with you, ask what are you struggling with and how can we help. Building a culture of support. Employers can adopt non-judgmental policies to support workers struggling with substance use. Families should practice active listening and avoid confrontational languages. Schools should educate students on empathetic communication regarding addiction and recovery. Now, what can be done? Reduces fear of judgment and encourages individuals to seek professional help. Helps break cycles of silence and secrecy around addiction in families and communities. Strengthens social support networks that are essential for recovery. Now, addressing stereotypes in media. The media plays a crucial role in shaping public perception of addiction. Unfortunately, the substance users are often portrayed in a negative light, either as criminals, morally weak individuals, or lost causes. These portrayals reinforce harmful stereotypes and discourages those in need to seek help. Common harmful stereotypes that come within are the hopeless addict suggest that recovery is rare or impossible. The dangerous drug user reinforces fear rather than understanding. The irresponsible partygoer ignores the complex social, psychological, and genetic factors that contribute to addiction. Promoting balanced narratives is necessary. Journalists should use non stigmatizing language and highlight recovery stories. TV shows and movies should depict substance use with nuance, avoiding exaggerated or villainous portrayals. Social media influencers and public figures can play a role in normalizing discussions about recovery and mental health. Examples of media shifting the narrative: documentaries and campaigns that showcase real life recovery journeys, news outlets using person first language and focusing on the solution rather than the fear tactics, public awareness initiatives that involve people with lived experience in shaping content. In the UK, efforts to change language around addictions are getting momentum, but more work is needed to ensure that stigma free terminologies and widely adopted in healthcare and media and public and policies are needed. Current UK initiative, the NHS has introduced guidelines encouraging non stigmatizing language in addiction treatment settings. Charities such as Release and Drugwise actively campaign for media outlets to use people first language. Public health campaigns are shifting towards a more empathetic and recovery focused approach. Challenges that still remain, though. Many news headlines still use stigmatizing terms such as drug addicts and clean. Some healthcare professionals unconsciously use language that discourages individuals from seeking treatment. Public attitude towards addiction remained heavily influenced by outdated, punitive narratives. Now, what it says is the language shapes the way we view addiction, recovery, and those affected by substance use disorders. By adopting compassionate, person first, and recovery oriented language, we can help reduce stigma, encourage treatment, and foster a more supportive society. The UK is making progress in addressing language related stigma, but ongoing efforts are still needed across border healthcare, media, and every conversation. It is need to be changed. Through awareness and advocacy, we can create an environment where individuals feel empowered to seek help, where recovery is recognized as a journey of strength and resilience. Promoting empathy and understanding for individuals struggling with addiction. Now, empathy is at heart of reducing stigma. Many individuals struggling with addiction face societal judgment, which can prevent them from seeking help. By fostering understanding and compassion, we can create a supportive environment that encourages recovery and healing. Now, if you really think about that, we have to understand the causes of addiction. Substance use is often a coping mechanism for deeper issues such as trauma, mental health challenges, and socioeconomic stress. It is simply a lack of willpower or moral failing. Understanding the causes of addiction. Substance use is often a coping mechanism for deeper issues such as trauma, mental health challenges, or socioeconomic stress. It is often simply a lack of willpower or a moral failing. Recognizing these root causes can help us respond with compassion instead of judgment. The factors that contribute to these addictions, one of them is trauma and adverse childhood experiences. Many individuals who develop substance use disorder have experienced physical, emotional, or psychological trauma. Mental health challenges that come with it are that anxiety, depression, PTSD, and other mental disorder conditions are often linked with substance use for individuals that are attempting to self-medicate. Socioeconomic factors such as poverty, lack of access to health care, and unstable living conditions can increase vulnerability to addiction. Genetic and biology does help and are cause genetic and biological factor also do cause it. Research shows that genetics and brain chemistry play a role in addiction susceptibility. Challenge the narrative. Instead of asking, why don't they just stop? Ask, why? What led to this point and how can we help? Instead of viewing addiction as a choice, recognize that as a complex health issue and requiring support and treatment. Practicing empathy. Empathy begins with listening instead of offering unsolicited advice and passing judgment. Simply being present and offering support can make a significant impact. Now, active listening. Pay attention, make eye contact, acknowledge feelings without interrupting. Avoid blame. Instead of saying you need to take responsibility, try, I understand you're going through a tough time. How can I help? Offer encouragement. Celebrate small wins in recovery rather than focusing on a setback. Be mindful of the language that you use. Avoid using terms like junkie or druggie. Instead, use people first language such as a person with a substance use disorder. Empathy in different settings. Healthcare doctors, nurses, therapists should approach addiction with compassion rather than punishment. Workplace, employers can implement supportive policies rather than immediately terminating individuals struggling with substance use. They should help out. Families and friends, loved ones should educate themselves on addiction to avoid reinforcing harmful stereotypes. Now, normalizing recovery journey. Recovery is not a straight path and setbacks are part of the process. By normalizing the reality, we create a safe space for individuals to be honest about their challenges without the fear of condemnation. Understanding the recovery process. Relapse is not a failure. Many individuals experience relapse before achieving long-term recovery. Instead of discouraging them, we should reinforce that recovery is an ongoing journey. Different recovery paths. Some people benefit from inpatient therapy while others find success in community-based support groups or medication-assisted therapy. Studies show that individuals with strong support system are more likely to achieve and maintain recovery. We should encourage open conversation about recovery. Schools, workplace, and community organizations should offer platforms for discussion about recovery journeys. Public healthcare campaigns should focus on recovery success stories to challenge negative stereotypes. Families should adopt a supportive and non-judgmental approach to their loved ones in recovery. Now, sharing stories to foster understanding. Hearing first-hand accounts from individuals in recovery can foster empathy, break down misconceptions, and inspire hope. Personal stories remind us that addiction can affect anyone and that recovery is possible. Now, the power of personal narrative. It reduces the stigma. When individuals share their experience, it humanizes the experiences, it humanizes addiction and challenges harmful stereotypes. Encouraging others to seek help. People struggling with addiction may feel inspired to reach out for support after hearing recovery stories. Building community connections. Public forums, social media, and community discussion can help create a sense of belonging for those in recovery. Now, what are the ways to share recovery stories? Community events, organized storytelling sessions where individuals in recovery can share their journey. Media and journalism encourage the press to feature stories of resilience and hope rather than media and journalism. Encourage the press to feature stories of resilience and hope rather than discussing addiction crisis. Peer support groups are necessary. Encourage those in recovery to mentor and support others who are beginning their journey. In the UK, efforts to promote empathy and understanding around addictions are growing, but stigma remains a barrier to treatment and recovery. By encouraging education, open conversation, and media responsibility, we can build a more compassionate society. Charities like Turning Point and Addiction UK offer platforms for individuals to share their recovery journeys. The NHS and various mental health organizations have launched campaigns to promote empathy in addiction treatment. Schools and community centers are incorporating additional educational programs about addictions and recovery. Challenges that still remain though. Many individuals still fear to seek treatment due to social judgment. Media portrayals of addiction often focuses on crimes and crises rather than recovery. Employers and healthcare providers sometimes lack training on how to handle addiction with compassion. Now, all this means is that empathy and understanding are essential in addressing addiction stigma. By recognizing the root causes, practicing compassionate communication, and normalizing recovery and sharing real life stories, we can foster a more supportive society. In the UK, it has made progress in shifting the narrative around addiction, but continuous efforts are still needed to ensure that individuals feel safe seeking help without fear of judgment. By working together, families, communities, healthcare professionals, and policymakers, we can create an environment where recovery is encouragement and supported. How community efforts can create a more supportive environment? Change. Change begins at the community level. By working together, we can create an environment where individuals feel supported in their recovery journey. Substance use and addiction impact not just individuals but entire communities, making collective action essential for meaningful change. Now, how to do that? Building awareness campaigns. Communities can organize events like Substance Awareness Week to educate the public about addiction, available resources, and ways to support those in recovery. Awareness campaign help challenge misconception and reduce stigma. Now, the strategies for effective awareness campaigns. Public education workshops. Host events in schools, libraries, and community centers to discuss the realities of addiction and the science behind recovery. Social media and digital outreach. Use online platforms to share educational videos, personal recovery stories, and resources for treatment. Collaboration with local businesses. Engage local businesses to support awareness initiatives such as displaying posters or distributing informational pamphlets. Engaging faith-based organization. Religious institutions often have strong community ties and can play a vital role in promoting compassion and recovery support. Real-world example. Now, in Glasgow, Scotland, community-led projects like this Cottage Drug Farm run educational programs that raise awareness about harm reduction and addiction recovery services. And creating safe spaces such as community centers and peer space. Creating safe spaces such as community centers and peer support groups provide individuals with judgment-free environment where they can share their experiences, seek guidance, and build supportive relationships. Now, the types of safe spaces though. Recovery cafes, social spaces where individuals in recovery can connect over coffee, participate in workshops, and receive emotional support. Peer support groups. Programs like Alcohols Anonymous or Narcotics Anonymous or SMART recovery provide structured support system. Youth focused support groups establishing mentorship program in schools can help young people discuss their challenges in a non-judgmental setting. LGBTQ plus support networks. Since LGBTQ plus individuals face higher rate of substance use, dedicated safe space for this community can be crucial in providing tailored support. Benefits of the safe space. Encouraging open and honest conversation about addiction without fear of stigma reduces feeling of isolation and promotes a sense of belonging, provides access to trained professionals and mentors for guidance. Real world example. The Forward Leads initiative is the UK provides non-judgmental spaces where individuals struggling with substance use can access harm reduction resources and peer-led support, encouraging volunteerism. Volunteering with addiction support services fosters empathy, strengthens the community ties, and offers individuals in recovery an opportunity to give back. Ways to get involved though. Mentorship programs is one of them. Become a mentor for individuals transitioning out of rehabilitation programs. Community outreach events, organize drives for hygiene kits, winter supplies, or transportation assistance for individuals attending recovery meetings. Fundraising initiatives. Support organizations that provide addiction treatment and harm reduction services, offering professional skills, healthcare workers, counselors, legal experts, and financial advisors can provide pro bono services of those in recovery. Now, the benefit of it strengthens the connection between community members and individuals in recovery. It provides meaningful engagement opportunities for those looking for to contribute positively to society. It helps remove social barriers that often prevent individuals from seeking help. Now, the Camden Recovery Service in London runs a volunteer membership mentorship program where the individuals in long-term recovery guide newcomers through early stages of treatment. Advocating for policy change does help as well. Community members can push for policies that prioritize treatments over punishment, ensuring that addiction is treatment. Community members can push for policies that prioritize treatments over punishment, ensuring that addiction is treated as a public health issue rather than criminal offense. Now, the key policy initiatives to advocate for increased funding for mental health services, expanding access to counseling, rehabilitation center, and harm reduction programs, decriminalization of drug possession, encouraging legal reforms that focuses on treatment and rehabilitation rather than incarceration, expansion of safe expansion of safe consumption sites, supporting location where individuals can use substance under medical supervision to prevent overdoses, workplace and housing protection for individual recovery, implementing policies that prevent discrimination against those seeking employment or housing after addiction treatment can also help these individuals. Now, how can you advocate though? Engage local politicians, attend town hall meetings, sign petitions, communicate with representatives about the importance of addiction recovery support. Community-led research and data collection, gather statistics and testimonials to present a case for policy changes. Partnership with advocacy organizations, collaborate with groups like Transform Drug Policy Foundation and Release to drive meaningful policy shifts. Real world example now. Everyone's Recovery Initiative in Manchester successfully lobbied for increased funding for mental health services, leading to the expansion of free addiction counseling programs. The UK has made strides in addressing substance though, as in community level, but challenges remain. While cities like London and Manchester have implemented harm reduction strategies, more widespread community involvement is needed to build an inclusive and supportive recovery network. Now, existing UK programs supporting community based recovery. Now, we are with you. This is a charity that provides free addiction recovery support across the UK for anyone going through addiction. CGL Change, Grow, Live offers treatment services, harm reduction initiatives, and community outreach programs. Public Health England. Now, this initiative government funded campaigns promoting substance use awareness and prevention do help as well. Challenges that still remain though. Many rural areas lack accessible addiction recovery resources. Stigma in certain communities still prevent individuals from seeking help. Funding cuts to mental health services can limit access to essential treatment programs. Now, this all means that community efforts plays a crucial role in supporting individuals affected by substance use. Through education, through safe spaces, volunteer initiatives, and policy advocacy, we can build a more compassionate and effective recovery network. In the UK, current approach to addiction treatment evolving, but sustained community engagement is necessary to ensure that long-term success is there. Whether you are a teacher, healthcare worker, business owner, a simply concerned citizen, your involvement can make a difference. Now, long story short is that it does help and you should do anything and everything you can. Thank you for joining for today's discussion on reducing the stigma of substance abuse. We explore the importance of addressing societal misconceptions, using compassionate language, promoting empathy, and fostering community support. Stigma thrives on misinformation and fear, but by working together, we can create a culture of understanding and acceptance. If you are someone or you know someone who is struggling with addiction, remember that help is available. Reach out to local resources and don't hesitate to take the first step towards recovery. To learn more about our program or access support, visit the Awakening Rehab. Together, we can make a difference. Thank you and take care. The keynotes that we can take from this is that misconception about addiction contribute to stigma. Addressing them is vital for change. Using non-stigmatizing language promote inclusivity and encourages treatment. Empathy and understanding are powerful tools in supporting individuals struggling with addiction. Community effort can create a more supportive environment for recovery. Thank you.